Hi, my name is John Thomas. I'm a physical therapist at Laguna Orthopedic Rehabilitation. Today I want to talk about something a lot of the runners I work with report, and that's heel pain or plantar fasciitis. Many times they report these symptoms in the morning. They wake up out of bed, they take a first couple steps, and they feel this pain in their heel. Also, they report it following a period of prolonged sitting. They get up those first couple steps, they feel that heel pain or that arch pain. Many times as the movement goes along throughout the day, their symptoms go away, but then they feel it again when they go back to running. What I want to talk about is how to prevent that, or how to address some things that might be causing the stress on that plantar fascia, resulting in pain. A little quick anatomy: the plantar fascia goes from the calcaneus, it branches out like a fan, and it inserts into the metatarsals. What happens with my patients is that it's getting overstretched. The fascia can only take so much pulling until it finally starts resulting in symptoms. Many times it can even turn into a heel spur, and then you start getting these symptoms, and then you can't run. Three things that I see with my runners is limited great toe extension, so the ability of the big toe to extend, because when you're running, you really need a lot of this movement to occur at the toe. You also need the ankle joint to come forward, and you need the calf to be flexible and elongated. If this doesn't happen, many times there's this overpronation from the midfoot, which pulls on the plantar fascia, which tugs on the heel, which results in pain. There's an article in Journal of Orthopedic and Sports Physical Therapy that I'm going to attach to the site you can look at. It'll give a good demonstration of these techniques that I'm going to show you. But real quickly, you want to work on finding any type of tightness or restriction in the calf muscle. You can just grab your thumb, run along the calf, search for these restrictions. Once you find it, these trigger points, you want to apply pressure and then work on elongating that tissue. That's one thing that you want to work on, because if this is tight, it's going to limit your ankle mobility. After you loosen it up a little bit, you want to follow it up with a stretch. You can do the wall stretch, lean against the wall, making sure that your heel isn't twisting out. You want to keep your arch nice and supported, lunging in until you feel a good stretch in the calf. You do not want to feel stretch in the plantar fascia. You don't want to overstretch something that's already being overstretched. Another thing, like I talked about, was the big toe. If this toe extension is lacking, other joints are going to compensate. To work on that, you just grab the big toe, immobilize the joint, try to extend it back till you feel a nice stretch, hold it. Physical therapists are great at working on manual therapy to increase mobility in your toe, your ankle, and your calf. And then really try to work on some of your movement patterns. You know, when you're maybe do a little jogging in place and making sure that you don't have any collapse going on, which is causing faulty movements of the ankle, which may be putting stress on that plantar fascia. Try those things to work on getting rid of that heel pain, and see your physical therapist if it doesn't work for you. Thank you.